Welcome to the American Board of Pathology Resident Orientation slide set. First thing I want to point you towards is the booklet of information on our website. It has all the answers to the frequently asked questions, and so this review is meant to just supplement that work. Allow me a moment to review the mission of the American Board of Pathology. It is, as a member of the American Board of Medical Specialties, to serve the public and advance the profession of pathology. How do we do that? By setting certification standards and promoting lifelong competency of pathologists. Sometimes there is some confusion with regards to the role of the American Board of Pathology and ACGME. ACGME accredits training programs, whereas ABPath certifies individual physicians. This and the next slide demonstrate the principal activities of the American Board of Pathology. Foremost, we establish certification standards. We assess the qualifications of those seeking to practice pathology, and we conduct voluntary primary and subspecialty examinations and award certificates to successful candidates. We also encourage the continuing certification of those practicing pathology. We participate in the review of pathology training programs and support program directors and trainees. We maintain a registry of diplomates and provide public reporting of certification status of our diplomates. It's important to note a few things that the American Board of Pathology does not do. We do not confer a license to practice pathology. We do not delineate who may practice pathology. We do not define hospital or healthcare organization privileges. We do not define the scope of practice of pathology, and we do not delineate practice standards. American Board of Pathology strongly supports the ACGME ABMS competencies, and these, by way of review, are medical knowledge, patient care, professionalism, interpersonal and communication skills, systems-based practice, and practice-based learning and improvement. The American Board of Pathology offers the following primary certifications: a combined certificate in anatomic and clinical pathology, a certificate in anatomic pathology alone, a certificate in clinical pathology alone, and a combined certificate of anatomic pathology and neuropathology. This and the next slide demonstrate the subspecialty certifications that are available through the American Board of Pathology. We offer certification in blood banking and transfusion medicine, chemical pathology, clinical informatics in conjunction with the American Board of Preventive Medicine, cytopathology, dermatopathology in conjunction with the American Board of Dermatology, and forensic pathology. Additionally, we offer subspecialty certification in hematopathology, medical microbiology, molecular genetic pathology in conjunction with the American Board of Molecular Genetics and Genomics, neuropathology, and pediatric pathology. Pathway is the American Board of Pathology's online system for board certification and continuing certification. Residents should log in annually to complete the honor code authorization form and update any personal information. Exam application links are available in Pathway. Pathway can be accessed from our main website, abpath.org. Make note of a couple particular areas in Pathway. The My Profile is where your personal information is stored. It's important to keep this information up to date, particularly with respect to mailing your certificate and for correspondence from ABPath. It is recommended that you use your personal email rather than the email at an institution, particularly if you're going to change that institution for fellowship training or work, etc. Primary certification application area is also present with important dates, deadlines, etc., and the same for subspecialties. Once you have completed your certification, and we know you will, you'll be automatically entered into the continuing certification program. And there are links here for the continuing certification program and board correspondence. Booklet information, which is available on the website, is really the complete guide for all things certification related. This booklet should be reviewed annually by the program director for the latest information on certification requirements, as well as keeping an eye out for notifications from the board office. The following slides will contain some excerpts from this booklet. Evidence of an appropriate medical education is also required. This can be met by demonstrating completion of an LCME accredited medical school in the U.S. or Canada, an AOA accredited osteopathic medical school, or a medical school outside the U.S. or Canada that's been deemed acceptable to the American Board of Pathology. Special attention should be given to the training requirements and the certificate the individual desires. For someone applying for an APCP combined certificate, 48 months of full-time training is required. This requires 18 months of structured training in AP, 18 months in CP, and 12 months of flexible training in either AP or CP. For an AP or CP only certificate, 36 months of full-time training is required, and that would be 24 months of structured training in either AP or CP and 12 months of flexible training in AP or CP. It should be noted that these may include up to 6 months of research. One of the requirements for certification is a current full and unrestricted license. If applying for a license but the license has not yet been received, then a copy of the letter or email from the licensing board is needed, as well as documentation of having passed the USMLE Step 3. The results of the examination, however, will be held until a full and unrestricted license can be presented. It should be noted that training licenses are not sufficient to meet this requirement. The autopsy requirement is a minimum of 30 autopsy cases, and the individual must be deemed competent as attested by their program director. This can include shared autopsies with no limit, but only 2 residents may share. Limited autopsies, a limit of 5, including single organ, and these cannot be shared. Fetal autopsies with a limit of 5. 2 can be macerated fetuses. These must be uploaded in the ACGME autopsy log. Complete autopsy requirements are available in the booklet information. There is an assessment requirement, which means you must successfully pass the certification examination. Individuals who are applying for the combined AP-CP certificate must pass both portions of that examination to receive that certificate. With regard to time away, residents can take up to 12 months away from training for any reason with the approval of their program director. Fellowships do not count as time away. Training duration must average 48 weeks per year. With regard to parental, caregiver, and extended leave for residents, the American Board of Pathology will allow up to 6 weeks of time away from training for purposes of parental, caregiver, and extended medical leave. Extension of training is not required if competency has been achieved. This does not apply to fellowships. Similar requirements are needed for subspecialty certification. And these, in short, are certification by the American Board of Pathology or another ABMS board with respect to primary certification, current full and unrestricted medical license, appropriate ACGME accredited training, and then you must pass the subspecialty examination. Please note the important dates for primary application, and that it is the responsibility of the resident who will be applying for the examination to make this application. Similarly, please note the dates for the subspecialty examination, application and registration, and again, the responsibility of the applicant. On our recently updated website, you will find exam dates, deadlines and fees, exam blueprints and exam descriptions, a practice tutorial, and a virtual microscopy practice area. The individuals are encouraged to use these practice areas to prepare for the examination. This slide provides a variety of websites and emails with regards to ABPath resources. I hope this tutorial has been helpful. Again, if questions exist after reviewing the booklet and information, feel free to reach out to the office. We look forward to being your partner in lifelong learning, and please follow us on social media. Thank you.